I had cancer in my 20s that literally devastated my life. So there's lots of reasons that can happen, and I want to welcome Dr. Nilesh Vora. So Dr. Vora is the medical director at Memorial Care Todd Cancer Institute at Long Beach Memorial Medical Center, right? At Long Beach Memorial? Yes.
Yeah, correct.
Board certified hematologist and medical oncologist. And he's a generalist with specialized interest in lung cancer, gastrointestinal cancers, colorectal cancer, pancreatic cancer, gastric, so many more, malignant hematology disorders, and has led and is currently involved in many clinical trials. So I don't want to go on and read too much of your bio because I want you to talk about it as we go through this program. But welcome, Dr. Vora.
Thank you. It's an honor to be here, and I really appreciate the opportunity to speak about something I'm so passionate about.
So yeah, tell us a little bit about how cancer treatment maybe has changed in the last few years. How have you seen it change?
Yeah, it's really been dramatic. I did my fellowship at City of Hope in Duarte, California, and I was there from 2007 to 2010. And I think, I was so lucky because it was right then when this, I would call it a revolution with regards to oncology care happened. And it was all about individualization of cancer treatments. So, I can't even imagine what it was like to treat cancer back in the 70s and 80s when we had 2 or 3 drugs to try for every single cancer. And it was literally like being in the dark and trying to fix a patient's illness with very primitive weapons, so to speak. And then since 2004 onwards, it was all about taking each cancer subtype and figuring out what the best form of treatment was for that individual person. And from there, we established new therapies called targeted therapies, where we understand the patient's DNA of their cancer. We figure out, and many times, the mutation that's making it grow, and then these amazing drugs target the mutations as opposed to targeting all the good cells that a patient has. And so it's amazing. You spare toxicity, you increase the chance of response. And so, things that are near and dear to my heart are the fact that patients can live longer, but then they can also live better while they're on cancer care. They can have minimal amounts of side effects. They can move forward and make beautiful memories with their families, and they can enjoy being alive. And that's why I think oncology care is so much better than it was, 10 years ago, 20 years ago.
That's so fantastic.
Yeah.
So one of the things that I really wanted to talk to you about, obviously we have psychiatric clinics. And I have a new book coming out called The Relentless Courage of a Scared Child. And in that book, I talk about early childhood trauma. But in my 20s, I was diagnosed with thyroid cancer, which seemed benign enough. They told me I wasn't going to die. They told me it was, a fairly safe cancer to have. But, cancer's tricky. It's complicated. And as a nurse, I've learned this as well. But the problem was I sort of felt like I had the world by the tail, and the cancer didn't do what they told me it was going to do. It had metastasized and come back multiple times. And so what they told me was going to happen didn't happen. I had to drop out of school. I had to quit my job. I filed bankruptcy, couldn't afford to pay my medical bills. And so I remember just that idea that this didn't go the way it was supposed to go, and everything in my life in my early 20s fell apart, and I didn't have a lot of support system, devastated me, not to mention that no one really explained what having no thyroid in my system back then, that's what we did before we did the radiation treatment, right? So no one really explained the effect that was going to have on me. And it was just enough to completely obliterate my life. We talk about treating people through 4 circles: biological, psychological, social, and spiritual. All 4 of those circles just got slammed, and I was completely bankrupt. So, and that's with a cancer that's not terminal.
Sure.
And then I even felt guilty that I felt so bad with a cancer that wasn't terminal. So talk a little bit. I mean, we see patients obviously all the time, not just from the emotional aspects of what happens when they get a diagnosis like that, but also the brain effects of what happens with the chemo and stuff like that, because it affects your brain.
Yeah.
Or it can. So talk to it.
Yeah, I think you're bringing up a huge point. I'm fortunate enough to work at the Todd Cancer Institute in Long Beach. where we have a really, really strong psychosocial program.
Mm,
It's led by a psychiatrist named Dr. Vora,
interesting.
who's a great friend of mine, and it really works hand in hand with what I do. So on one hand, I'm talking about what the scans look like, what the chemo is going to be like, what it's going to be like without a thyroid, for example. And so I spend a lot of time with patients talking about the effects of therapy. And I think that's so vital. It's really important to be connected to an oncologist or a team in which you can ask questions and
For
think
sure.
about what life is going to be like with treatment and have all your doubts, at least addressed to the best
Mm,
of our ability. You bring up a good point, which is we can't always predict what's about to happen or, which way things are going to turn. But there should be an ability for you, for a patient, to be able to say, hey, can you explain one more time to
mm.
what's going on? So I think that's one part of my answer to your point, which is the relationship you have with an oncologist being so vital and so important, and your treatment team. And
For
then the second point, which I think you're alluding to, that I think is just as important, is the support you get from the team around the oncologist. So the social worker, the psychiatrist, the the village that's there to support you. And like I said, I'm fortunate to work at a center where you know the part outside of the physiological part is still really important, the mental part, the spiritual part, the emotional part, and there's so much data now that suggests that that's just as important as anything else as we're treating cancer. So I love it that you're addressing that. It's the elephant in the room. It's the part about cancer that patients fear.
Yeah.
What's life gonna be like? And it needs to be addressed. It needs to be talked about because it's not just about CT scans and chemotherapy and surgeries. It's about the whole picture. So,
And one thing, if I could be so bold as to say, just because of my own experience and what we do, there's no way to predict how people are going to emotionally react to something like that, how it's going to affect them. As a nurse in the hospital, I've seen people with a terminal diagnosis who did incredibly well.
mhm,
And then I've also seen people who, like me, knew that they weren't going to die, but for other reasons really struggled and just sort of fell apart. And so I think it's really important to have grace with yourself and understand like it's complicated. There's a lot of reasons for those things. I mean, your spirituality, your sense of purpose and meaning, your family connections. I mean, all of those things matter. Not to mention, we would argue that your brain health going into it matters. We call it reserve. So
yeah.
your health, your even not just your brain, but your body reserve. How healthy you were going in probably makes a difference.
Yeah, I
So,
think everything, the whole picture needs to be addressed. And
mhm.
and you gotta have that village behind you to support.
Mm.
I mean, it's just so important. So, you
I
know,
love
I
I love that we're approaching it that way today.
yeah.
I didn't get that sense. I didn't get that at all when I was young. But I love that that's how we are looking at it today.
Yeah, I think about you in your 20s going through what you went through. And I think about how lonely that must have felt because I think cancer is so lonely. It can be such a lonely disease. You don't know what your future is like. You don't know if you're going to make it to your next birthday or your next, and if you focus on that, then life becomes really hard. Uh,
Yeah, and one thing, sometimes your family members, well-meaning as they are, sometimes say things that they don't really realize. Like I remember my mom. So I'm one of the things I was going through my cancer treatments at the same time my mom was recovering from brain surgery. Was
mm,
a very crazy time. So that didn't help. But I remember she was so grateful that I wasn't going to die and that she was, recovering, that she could not understand why I wasn't more positive and more grateful. And so all she kept saying is, snap out of it. Why aren't you more grateful? You need to be more. And I'm like, if she says that one more time, because
mm,
all I want to do is die right now. So
mm.
I was really depressed. So if I could like say one thing to people watching, if you are a support system for somebody going through cancer, just be very sensitive to what they might be going through.
Yeah.
And they're not going to take it the same way you are. You're probably very happy that they're with you. They might be feeling very differently. So grace goes a long way.
I think there's a very important question to ask for me, for patients, and it's very simple. It's how are you feeling today?
I love that. Yeah.
How are things going? And it's really not just saying that just to, reflexively say that, but it's saying it with great interest.
Right.
and allowing patients the opportunity to express themselves. It's just so important. It's
I
so
love that. So how has working with cancer patients changed your perspective on life?
it's dramatically changed it. You know, I feel so lucky about being in this position because it's allowed me to look back at my life, um, my wife, my three children who are all under the age of 9, and just be able to cherish the days that we have together, because things change, life changes,
Like so
and yeah, so quickly. And I get to, I see that on a daily basis at work. But I never miss an opportunity to create a memory. I never miss an opportunity to enjoy a day, an
love that.
afternoon, an evening, and it puts a smile on my face because I think I have no regrets. I have no regrets because um, life isn't about regrets. It's about making memories. I always tell patients this too. We're here for a very short time period, a
Yeah.
very, very, very short time period on this earth, and it's not worth it to spend time not being as happy as you can be.
I love that. We will often say one of the things that helps me, a question that I came up with that I love that helps me is, does it have eternal value? Because life is so short. It's like, I'm not going to focus on the little things that don't have eternal value. Most things are small things.
Yeah.
And being a nurse, so I worked in the trauma unit. I wanted nothing to do with what we called walkie talkies. And because of my book, people who read my book will understand that I didn't want to hear patients like problems, but it had to do with my own childhood trauma. I wanted the blood, the guts. I wanted them sedated and intubated, right? I
Mhm.
dealt with that much better
Yeah.
than any sort of emotional issues with patients.
Yeah.
And but something happened. I had to work for a short time in the children's oncology unit, and I almost changed what I did. Like, I almost changed my specialty to work in that unit. I was It was so impressive. The parents were kind of a mess. They were a disaster. I will say that. And that makes sense. I would be a disaster. I'd be a mess. But the doctors on that unit were phenomenal. I mean, the nurses were phenomenal. The doctors were phenomenal. The kids were incredible. And I remember walking on that unit and I'd see doctors like painting happy faces on their little bald heads, and they would play games and play football in the unit. And I'm like, what is happening here? It really did something to me to
Hmm.
this ability for these kids who knew they might be dying, to learn to appreciate each day
Yeah.
and just enjoy the people around them and what's happening in the moment.
Yeah,
And
that's the message I like to impart on my friends and the people around me who don't have a terminal illness. To keep it bluntly, it's really such a valuable idea of making each day as great as possible.
I
And,
love that.
and I love it that you saw that because
Oh, it was so great.
yeah,
I didn't think I could do it, and then I just fell in love with that unit. It was a precious unit. It was a hard unit, but it was a precious unit too. I learned so much, and I mean, it triggered me a little bit from my own past, but it just was such a beautiful thing to see these people learning. And I mean, it was sad. The one thing I will say was sad when I saw kids that just knew way too much about. I mean, they had to, but they knew so much about their own care, more than some of the medical professionals that would show up that didn't know a whole lot. Some of the new residents and new nurses, and these kids are messing with their own IV bags, and it's really interesting place to be, though. It's a really interesting place to be. And between my own perspective as a young person who went through a severe depression, wanted to die at one point, and then fast forwarding to being in that unit and being a nurse, it really does change your perspective on life. It's pretty incredible.
yeah. I mean, that's how I feel almost every single day. You walk in and you have a patient come to your office and you think, this is unbelievable. You shouldn't be here right now. The care is so good. The treatment is so good that you are winning. And then it's about, allowing them to enjoy what they're living for. And it's just beautiful. It's
I
a
love
great
that.
time to be an oncologist. I'm
I can just see how much you love it and the joy in your
just
face.
so
So
in love with it. Yeah.
I love that. So I read here that you helped create a charity called the Bucket List Project.
Yeah. It's a perfect segue. Yeah, so this is a story that I love to tell. When in 2012, I was a relatively new oncologist. I had a patient of mine, a young man named Kenny, who was 54 years old. He was diagnosed with metastatic colon cancer. And the colon cancer had invaded into his abdomen and caused his intestines not to work very well. And so before we got a chance to start any chemotherapy to reduce the burden, he ended up in the hospital with a bowel obstruction.
Mm,
And he had to be put on artificial nutrition and, continued to deteriorate. He was in the hospital for 30, 35 days, while we tried to help him. And during that process, we had a surgeon, named Dr. Grant, come in, and I convinced Dr. Grant to do a surgery where we could relieve the obstruction and just help Kenny out. Um,
mm,
and soon, Kenny started eating. He had to have a colostomy bag, but at least it bypassed the obstruction, and he started eating. And he went from being totally bedbound and having lost 122 pounds, down to 130 pounds total, to being able to gain a little more weight again, to eat again, to get out of bed, to walk. He got discharged from the hospital. He came to my office. We started him on chemotherapy, and you could see him getting better.
mm.
And so it was great. And I sat with Kenny and I said, this is temporary. At some point, this chemotherapy is not going to work anymore, and the cancer is gonna get worse. And like I told many patients, I said to Kenny, I want you to make a list of things you want to get done, and get them done. Enjoy life, live life as well as you can. And so I happened to stumble upon Kenny's social media page, and he had written this post that said, "My doctor told me to make this list of things to get done." And so here it is. I just can't afford to do anything because I don't really have the
Oh,
resources for it. And I thought, oh my goodness, like I could not believe that Kenny had made a list, that he had thought about this, and that he didn't have the ability to do this. And so I was the director of our palliative care team at the time. And I said, this is palliative care. This is supportive care. We're going to help Kenny. And
oh,
so we got him a photo shoot. He said, I want to take pictures before I don't look very pretty anymore, he said.
oh,
And so we got a photographer to come in and do a free photo shoot. And we also had him go to the Ellen show and be front row, because that was always a dream of his. And his parents were on the East Coast, and they wanted to see him, and we flew them out here to enjoy a lunch with us and my whole team. And then his last wish, as he went forward, was to make this something available to other patients, which I thought was so amazing,
selfless. Yeah.
selfless of him. He said, I want other patients to have this opportunity because this changed my life. And so we created something called the Bucket List Project.
I
And
love that.
Kenny passed away 2 years later, after
Mhm.
after he had made his wish list. But before he passed, he knew that this program was up and running. And we are 8 years later, and we've created weddings for people. We have sent people to Hawaii. We have done other photo shoots. Um, we've done these unbelievable, sort of grants of wishes. We had a famous Channing Tatum came to the hospital and performed
Wow,
a choreographed dance for an 18-year-old girl who was afflicted with
that's
cancer.
fantastic.
Like it, and everybody comes together. It's that whole village thing again. Everyone comes together and they think, I know someone, I can help this situation, and I would love to do this. And so the Bucket List Project is up and running, and we do about 2 or 3 wishes a month for
That's
patients.
fantastic.
And it's for adults. And there's nothing like this. There's nothing
Um,
like this. And again, it fits with the philosophy that I was telling you earlier, that every day should be as great a day as possible. There shouldn't be a day spent that is worried about, things you don't have control over. And
It's
this
so
is how.
obvious to see your heart in this. You have a very special heart. It's clear to see how much you care about the people you treat, and that's really cool to see.
It's more than just a scan that shows
Mhm.
that the cancer's smaller. It's
Mhm.
about the whole person, and that fits with everything you believe in.
Yeah.
And the idea of relentless courage is amazing to me, because it's about the time we spend here, and it's about the courage to go forward.
I
So
love
I
that.
appreciate everything you've said today too.
Well, and yeah, thank you for that. And one thing I have a question about, because it's a really weird time right now
Yeah.
with COVID and people not getting diagnosed. I mean, one thing we see, I mean, and our clinics are busier than ever, which is, it's sad that they're busy because of the reason they're busy, but they are busy because people are suffering. So
Yeah.
depression has tripled. People are afraid to go to hospitals even when they need to. They're letting their heart disease get out of control. They're not being diagnosed with, or treating diseases that they should. What's going on with cancer today? Like, are you seeing any problems with this?
Yeah, absolutely. So March hit and everything closed. Our clinics closed, chemotherapy was put on hold. Soon after, we realized that this was not going to be a short-term epidemic,
Mm,
that this was going to be long-term. And so we had to make adjustments to our hospitals and our clinics to be safe. And we
mhm.
had to invite patients back to get their needed chemotherapy. So I applaud the hospital for swift measures to make sure everything was done properly and safely. But screening tests were on hold for 3 months. So mammograms were delayed, colonoscopies were delayed, patients were afraid to go get their labs checked. Rightfully so. I mean, the way we painted this pandemic was
Right.
be very careful and, do not interact with anyone unless you absolutely have to. And,
Mm.
the idea of flattening the curve was placed for a reason. I get it, but it created the fear. uh,
Another problem.
yeah, we created this fear that ended up leading to big problems. We're picking back up now. I'm happy to report that elective procedures are being done, um, screening tests are being done. But yeah, the next, I would say, 3 to 6 months are gonna be really busy, as patients get more and more diagnoses done, as patients have their cancer staged a little later than they could have had they gotten their
Mm.
mammogram done or colonoscopy done a year prior. Um, I think it's really important for patients to know that you still have to take care of you. You still,
Well, and probably patients are going to struggle even more with the emotional components. Like you said, this whole village idea, they're probably struggling a bit more than usual
yeah,
because of this, they're not able to reach out to that same village. I mean, thank God I've never, we're not big fans of social media, but Zoom, if you have no way to reach out to people personally because you happen to be a high risk individual, please make sure you're reaching out by Zoom. I mean, I know I was starting to get wonky just being in the house, and not going anywhere, and I'm not sick. So I know I started to like reach out to a group of friends for support. We have a weekly meeting and we do a prayer group and we do, we just socialize on Zoom. Just do something. Do the best you can. Focus on what you can control, not on what you can't control, because that's got to be a really hard thing right now.
yeah, I completely agree. And as I said, our support group here at Long Beach has set up Zoom visits, and things have picked up. And so the village is back in order.
So you left private practice to go to the Todd Cancer Institute at Long Beach Memorial. You obviously are happy with that decision, it sounds like.
Yeah, yeah, yeah. I love it. I joined a village that was already here. I was one of the first oncologists to come on board, but the ancillary staff was all here. The support groups were all here. So it just makes this idea of taking care of the whole patient a little bit easier when you're not the only caretaker for your patient.
Oh,
So I
for
do
sure.
that part too.
I love that. So I am so grateful to you. We have lots of questions. I know how busy doctors are. I've worked with a lot of them. So I didn't want to interrupt you. We're going to have lots of questions to answer. We'll take care of those following the episode, if that's okay. And so we'll get to you. Please don't feel like we're ignoring you. And do you have any last bit of advice before we end the segment?
I want people to understand that cancer care has come a long way, and that it's really important to get in touch with and establish a relationship with an oncologist that you really feel comfortable with if you're diagnosed with cancer. This is it's no longer gloom and doom in the world
Mhm,
of oncology.
for sure.
Um, so and I do think there's so much about the mental part of this journey that helps you as you move forward. And so I tell patients all the time, it's okay to be upset, it's okay to cry, it's okay to be unhappy, but process that. Go put on your boxing gloves,
Mhm.
and then come to clinic, and I'll be here waiting to fight alongside you, along with the rest of your team. Yeah,
So I practice
I
martial
and
arts
I
for a reason. I actually took up martial arts for that reason because I adopted a warrior mindset. That's my metaphor for life. It's like when I felt my weakest, I'm like, what's the opposite of me right now? A warrior. And so I started practicing martial arts a long time ago. And it's just this concept of being armed, prepared, aware, learning how to fight, trying to avoid the fight by being aware.
yeah,
But if you have to fight, win, right? So, stay strong. And you can't show up on fight day to win a fight. You got to train every day.
yeah, yeah,
So I
yeah.
love
So
that. Put the boxing gloves on.
there you go. Come put them on, and I'm here with you, and I can't wait to beat these things.
Excellent. Well, I appreciate your time so much. So thank you so much for your time. If people are suffering, I want them to know they can reach out. You can find Dr. Vora at memorialcare.org/TCI. His social media account is LB Medical Center. And if you think you might be, you need to get treated, or you think you might need a diagnosis, or anything's going on that you're suspicious of, don't hesitate to call 562-933-1877. And of course, for the mental side effects, which I know all too much about, if you're struggling with depression or anxiety, or you're having a lot of brain fog or memory problems following some chemotherapy, we certainly have doctors to help you at Amen Clinics at 844-818-0616. And you can go to tanaamen.com for all sorts of materials that are free of charge to help you find these resources. So we are just so grateful to you. If you share this video and tag 3 friends, it'll enter you into a drawing for a 6-month Brain Warriors Way online course at a $395 value. And don't miss next week's show. We have a special surprise.